FASENRA is indicated for the add-on maintenance treatment of patients with severe asthma aged 6 years and older and with an eosinophilic phenotype. FASENRA is not indicated for the relief of acute bronchospasm or status asthmaticus.
Christy loves nature, with exploring national parks across the country being a lifelong hobby of hers and her husband. But as she has gotten older, her asthma continued to worsen, making it difficult to travel to new parks. When it came to her asthma medications, Christy had tried a lot. As a 51-year-old with severe asthma, she had significant allergic triggers and had been on various treatments, including high-dose ICS-LABA controllers, Montelukast, and a rescue inhaler. When I first met Christy, she was frequently exacerbating, requiring monthly prednisone. Her OCS dependence came with its own side effect of Cushing disease. At the young age of 51, she told me she felt trapped in her own home due to her symptoms. I decided to measure her blood eosinophils, and her CBC with diff revealed 800 cells per microliter. I diagnosed her as an eosinophilic asthmatic with allergic features. With an eosinophil count that high, and her asthma remaining uncontrolled, I believed it was time to try a biologic to help treat her asthma. I considered the options and started Christy on an anti-interleukin-5 biologic that targets the IL-5 cytokine, with the hope of reducing her eosinophil count and exacerbations. After 8 months of being on therapy, Christy was still exacerbating once every 3 months, and while her eosinophil count decreased after starting biologic therapy, it remained above 150 cells per microliter, so I reevaluated her treatment plan. At this point, I considered this an inadequate response for Christy. I still believed her to be an eosinophilic asthmatic, so that's why I wanted to start her on FASENRA, because it is designed to target the interleukin-5 receptor on the surface of the eosinophil. The mechanism of action in asthma has not been definitively established. Christy and I discussed the risks and benefits, and we decided FASENRA could be the right next step for her. One month later, after starting FASENRA, when Christy came back to my office for her second dose, she told me that within just a few days of her first injection, she could feel a difference in her asthma. She was breathing better. Christy used to take her rescue inhaler 3 to 4 times a day. Now she rarely reaches for it. Christy's blood eosinophil count is now at 0. She's no longer OCS dependent, and because of this, her Cushing disease has resolved. Previously a frequent exacerbator, Christy has only had 1 outpatient exacerbation since being on FASENRA. Now that's just Christy's experience. Other patients' experiences may differ. This has shown me that not all biologics that target eosinophils are the same. Christy said she no longer feels like a prisoner in her own home. She's back outside and back to exploring national parks with her husband. While this is one of my first experiences with FASENRA, it was a real game changer for me in my practice. FASENRA is different.
Please stay tuned for some important safety information about FASENRA.
FASENRA is indicated for the add-on maintenance treatment of patients with severe asthma aged 6 years and older and with an eosinophilic phenotype. The treatment of adult patients with eosinophilic granulomatosis with polyangiitis, EGPA. FASENRA is not indicated for the relief of acute bronchospasm or status asthmaticus. Important safety information. Contraindications. Known hypersensitivity to benralizumab or excipients. Warnings and precautions. Hypersensitivity reactions. Hypersensitivity reactions, e.g. anaphylaxis, angioedema, urticaria, rash, have occurred after administration of FASENRA. These reactions generally occur within hours of administration, but in some instances have a delayed onset, i.e. days. Discontinue in the event of a hypersensitivity reaction. Acute asthma symptoms or deteriorating disease. FASENRA should not be used to treat acute asthma symptoms, acute exacerbations, or acute bronchospasm. Reduction of corticosteroid dosage. Do not discontinue systemic or inhaled corticosteroids abruptly upon initiation of therapy with FASENRA. Reductions in corticosteroid dose, if appropriate, should be gradual and performed under the direct supervision of a physician. Reduction in corticosteroid dose may be associated with systemic withdrawal symptoms and/or unmask conditions previously suppressed by systemic corticosteroid therapy. Parasitic helminth infection. It is unknown if FASENRA will influence a patient's response against helminth infections. Treat patients with pre-existing helminth infections before initiating therapy with FASENRA. If patients become infected while receiving FASENRA and do not respond to anti-helminth treatment, discontinue FASENRA until infection resolves. Adverse reactions. The most common adverse reactions, incidence greater than 5%, include headache and pharyngitis. Injection site reactions, e.g., pain, erythema, pruritus, papule, occurred at a rate of 2.2% in patients treated with FASENRA, compared with 1.9% in patients treated with placebo in asthma exacerbation studies. Use in specific populations. The data on pregnancy exposure from the clinical trials are insufficient to inform on drug-associated risk. Monoclonal antibodies such as benralizumab are transported across the placenta during the 3rd trimester of pregnancy. Therefore, potential effects on a fetus are likely to be greater during the 3rd trimester of pregnancy. Please read full prescribing information, including patient information, at FASENRAHCP.com.